Members, this bill, House Bill 315, is asking for $2,462,000 from non-recurring from general revenue to the Department of Health, which would be given to the University of Florida medical marijuana efficacy and safety evaluation. Members, I sat on the 2014 Criminal Justice Committee that produced the Charlotte's Web bill. This was the first effort by the state to step into the realm of legalizing some form of medical marijuana. This was pre-2014 amendment that failed, and of course pre-2016 amendment that passed. Much of the debate we had in that committee and going forward with the legislative session was that the FDA has not done enough study towards medical marijuana, and therefore we should not venture into legalizing. We decided that we would give authority to the University of Florida to conduct studies and conduct research. This bill will allocate $2.462 million towards that effort, and that is the bill, Mr. Chairman.
Thank you very much. Members, any questions on the bill? Representative Baez, any questions?
Are House member eligible to participate in the testing of this bill?
Representative Eagle.
Thank you, Mr. Chairman. Not with this bill, no. I guess you'd have to contact the University of Florida. Thank you.
Thank you.
Additional questions? Representative Richardson, any questions?
Thank you, Mr. Chair. So you said that the FDA has not done any research. Have they stated why they haven't done any research?
Representative Eagle.
It's illegal federally.
Thank you.
Additional questions? Representative Stevenson, any questions?
Thank you, Mr. Chair. I was just wondering if other states or several other states have entered into the legalization of medical marijuana, if any other states are doing research and if this will be coordinated with them.
Representative Eagle.
Thank you, Mr. Chairman. During the 2014 session, I believe there was not enough research or enough that we wanted to go on with states' rights. We wanted to enter into our own. We can look into that, but I don't have a clear answer on that.
Thank you, Mr. Chair.
Additional questions? Representative Harrell, any questions?
Thank you very much, Mr. Chairman, and I totally support the research that this anticipates and look forward to it very much so. But my question goes back to a previous question, is that the federal government does not acknowledge a medical marijuana as worthy of research or efficacious enough or whatever. It's still a Scheduled I drug. I know University of Mississippi does have a federal permit to grow medical marijuana and to do some testing on it. Where is the University of Florida going to receive their marijuana to test, or how are they going to go about doing this, given the federal prohibition against marijuana?
Representative Eagle.
Thank you, Mr. Chairman. They will be working with the growers and dispensaries. They'll be working with the health providers and with the patients through the whole studying process. So it will be strictly a statewide effort.
Follow-up.
Follow-up question?
Yes. So from your answer, I'm anticipating that all individuals who receive an order for medical marijuana, would all of those participants then become part of this study?
Representative Eagle.
Yes, thank you, Chairman. To my understanding, they would be. I assume it would be voluntary to some degree, but the University of Florida would be following up with each patient and asking them to participate.
Thank you very much.
Dr. Pigman, any questions?
Thank you, Mr. Chair. Is it true that this bill will allow, if the House offer on medical marijuana is passed, to do the evaluation of the care plans and to look for practice patterns in the individual and the aggregate on those people who prescribe medical marijuana?
Representative Eagle.
Thank you, Mr. Chairman. Yes, that's true, Doctor.
Outstanding. Representative Richardson, any questions?
Thank you, Mr. Chair. Just to follow up on my question, because I knew it was illegal, but I wasn't aware that the federal government wasn't going to do research because of the position on the law. So have you specifically researched federal monies for this research? And I'm not trying to put you on the spot, because if we don't know the answer, I think that's something that we should look at to see what if the federal government's doing anything. So can you comment on that?
Representative Eagle.
Thank you, Mr. Chairman. Follow up, if I could. Are you talking about grants or some sort of federal assistance aid?
Yeah, go ahead.
So I'm just curious if the federal government, because I think Rep. Harrell mentioned some funding that was going to another university. So I'm curious if the federal government is putting money around the country in different universities for research, if you know.
Representative Eagle.
Thank you, Mr. Chairman. I don't know, but I'd be happy to help you look into that. Any assistance we can
I appreciate that, and Chair, either that or we maybe could have staff do some research on that, just so we'll know the level of funding that the federal government may or may not be providing into this. I think that'd be helpful. Thank you.
Sure. Additional questions of the sponsor? Seeing none, is there public testimony? Any debate? Representative Harrell on debate.
Thank you very much, Mr. Chairman, and I want to thank you, Representative Eagle, for this very well thought out package to really address what I think is one of the key issues, and that is addressing the efficacy of medical marijuana. Without this kind of research, we really have no idea. We have a lot of anecdotal evidence and a lot of hype, but we have no concrete medical evidence that meets the requirements of scientific research. I think this is a key component of what will hopefully be a realistic bill to implement the constitutional amendment. So thank you very much. I totally support this, and I look forward to the results.
Thank you very much. Anybody else in debate? Seeing none, I'll make one comment, as I think it's important that we do aggregate that data to look at practice patterns. That's really step two of what we talk about when we talk about medical marijuana. One of the reasons why we don't have it a lot in the national framework is because every state does it a little bit differently, and so it's hard to have apples to apples. This is the first step in which we would be able to identify the efficacy, the side effects, some of the safety concerns that we have, and so I'm excited about the project. You are now recognized to close on your bill, sir.
I'll waive close. Thank you.
Having waived close, Sanjay, please call the roll on House Bill 3159.
Vice Chair Harrell.
Yes.
Ranking Member Richardson.
Yes.
Representative Baez. Yes. Burgess. Yes. Burton. Duran. Yes. Grawl. Yes. Jones. Yes. Magar. Yes. Mercado. Yes. Hickman. Yes. Romel. Yes. Stevenson. Yes. White. Yes. Chair Broder.
Yes, members, by your vote, please show House Bill 3159.